Good morning students, how are you? In this video today I'm going to discuss the carotid artery system, and mainly my focus would be on branches of the external carotid artery. So here we have got arch of aorta, and there are certain branches which arises directly from the arch of aorta. On right side we have got brachiocephalic trunk, which divides into subclavian artery and common carotid artery, whereas the arteries with the same name arise on the left side independently without involving any brachiocephalic trunk. Subclavian artery arises independently and directly from arch of aorta, then common carotid artery as well, arising independently and directly from arch of aorta. So there is no brachiocephalic trunk on left side. That's the only difference. Then we have got common carotid artery on one side and common carotid artery on other side. This common carotid artery moves upward, in the neck within the carotid sheath, and at the level of the superior border of the thyroid cartilage, here thyroid cartilage, it divides into two: internal carotid artery and external carotid artery. Internal carotid artery doesn't give any branch within the neck. It doesn't give any branch within the neck, rather it moves upward to the base of the skull, and it will enter the base of the skull through the carotid canal into the cranium. Then we have got external carotid artery. External carotid artery mainly supplies the neck structures. It has got in total 8 branches. Out of these 8 branches, we have got 2 terminal branches. One is maxillary artery and other one is superficial temporal, because it is supplying the temporal region. Superficially it is supplying it. Then we have got maxillary artery, and this division, these terminal branches, it means that external carotid artery terminates by dividing into these 2 branches, and this division is happening within the substance of the parotid gland. This is happening within the substance of the parotid gland. Then we have got this external carotid artery has other 6 branches as well. And before going into the detail of those 6 branches, it is important to know that this external carotid artery has got certain surfaces. As this cursor you are seeing, this is lateral surface, because this is the lateral view you are looking at. This is the lateral surface. Then it has got anterior surface, then posterior surface, and then it has got medial surface. So surfaces are important to understand, because there are branches, 6 branches which are arising from the medial, posterior and anterior surface. From the medial surface only branches ascending pharyngeal. As you can see in the background here, this artery ascending pharyngeal, it is ascending upward along the pharynx, and then here you see it is passing superficial to the superior constrictor muscle of the pharynx. Here you see in the background. Then this artery moves upward. After supplying this muscle, pharyngeal muscle, it is moving upward, and here it is entering, one of its branches entering the through the foramen at the base of the skull and supplying the meningeal branch. Then one branch is supplying the middle ear cavity, then other structures, pharyngeal structures as well. Then posterior surface have got 2 branches: occipital artery, which is the first branch. Then the second branch is from posterior surface is the posterior auricular. Occipital artery, as you can see, it moves upward and posteriorly. On its way upward, it is being crossed by the hypoglossal nerve, and this artery is crossing internal carotid artery. Here you can see in the background, and this artery is passing superficial to the internal carotid artery. Then the same artery is crossing the 11th and 9th cranial nerves. 11th and 9th cranial nerves in the background, here you can see, and this artery is passing superficial to those. and at the same time this artery is present medial and parallel to the posterior belly of digastric. Here you can see this is posterior belly of digastric muscle, and here we have got anterior belly of digastric muscle, and in between we have got intermediate tendon. So this muscle has been cut and part of it has been removed just to give you a glimpse what is happening deep to this posterior belly of digastric muscle. Occipital artery is passing medial and parallel to the posterior belly of digastric, and here you see into the posterior if you remember my previous video where I have discussed about the posterior triangle of the neck. If you remember, the posterior triangle of the neck is been further divided into supraclavicular and occipital triangle. So this is the occipital artery which emerges from the apex of the posterior upper part of the posterior triangle. So that's hence that triangle was named as occipital triangle because of presence of this occipital artery. Okay, then we will discuss about the posterior auricular. As you can see, this posterior auricular is the second branch or last pre-terminal branch. I mean, before termination into these two superficial temporal and maxillary artery, the last branch of the external carotid artery system on is posterior auricular. This posterior auricular. As you can see, this is external acoustic meatus, and here is the mastoid process at which sternocleidomastoid is attached. It is passing through between these two structures, and this posterior auricular branch is supplying the surrounding structure, facial nerve, and scalp as well. Here, occipital artery is also supplying the posterior part of the scalp. So, on its way upward, this artery is crossing the internal carotid artery. So what we have discussed of ascending pharyngeal from the medial surface, and from posterior surface occipital artery and posterior auricular artery. On the anterior surface of the this external carotid artery, here we have got a superior thyroid artery, because it is supplying the superior part of the thyroid gland. So it is moving anterior inferiorly and supplying the thyroid gland, anterior surface of the thyroid gland. Each lobe on either side being supplied by the superior thyroid. And if you remember, this thyroid gland is present deep to the strap muscle or infrahyoid muscle, sternothyroid. So strap muscles are present superficial to this gland, and then sternocleidomastoid is also present superficial to this gland. So this artery not only supplying the gland but also supplying the infrahyoid muscle and sternocleidomastoid muscle as well. And beside that, here we have got certain branches, which is, look at this, superior laryngeal. This superior laryngeal artery is piercing the thyroid membrane. This is thyroid membrane. It is present between the superior border of the thyroid cartilage and hyoid bone, thyroid. And beside that, we have got second branch of the anterior surface is lingual artery. This lingual artery loops anteriorly and superiorly, and on its this loop anterior superiorly on its way into under the hyoglossus muscle. This is hyoglossus muscle, you can see in the background, and before that this artery is being crossed by hypoglossal nerve. Hypoglossal nerve is the motor supply of the tongue. It is going to supply the tongue muscle. And then, as I mentioned earlier, posterior belly of digastric muscle and stylohyoid muscle, they are also crossing this branch, as these muscles have been cut and removed just to give you the overview of the underlying structure. That's why you cannot see these structures crossing this artery. Actually, this artery is present deep to posterior belly of digastric muscle and stylohyoid muscle, and then this artery loops in under the deep to the hyoglossus muscle. Hyo means hyoid, and then this muscle goes to the tongue, hyoglossus muscle. Then last branch, which is facial artery. Facial artery either it arises independently, directly, or with a common trunk of the lingual artery. This facial artery from anterior surface, it is also present deep to the posterior belly of the digastric and stylohyoid, and it is also being crossed by the hypoglossal nerve here. Then this artery gives two branches. One is ascending palatine. It ascends and supplies the reach the palate of the ascending palatine. Then we have got tonsillar artery. Tonsillar artery. It is very important branch of the facial artery. It is going to supply the palatine tonsil. Then this artery loops anteriorly in a groove present between the this mandible bone and the mandibular gland, salivary gland. Then at the inferior border of the mandible, mid-anterior inferior border, this artery loops, and here its pulsations can be felt by clenching the teeth just anterior to the masseter muscle when it loops over the inferior border of the mandible, and it becomes facial artery, and it has got tortuous course on the face. Then it gives another branch which is called submental artery. Here you can see in the background. Facial artery moves through the face, and then submental artery. So this video was all about the branches of the external carotid artery. I hope I tried to my level best to explain them. Rest of the characteristics of this arterial system I would be discussing in next video. Thank you very much.